Hello, my name is Hope Corrales, and my project I'm going to be talking about is cardiac transplant. So, what is cardiac transplant? It is a surgical procedure to replace a diseased heart with a healthy one, typically for end-stage heart failure or certain congenital heart defects. Involves removal of recipient's heart and implantation of donor heart. Requires skilled surgical team and organ donor for donation, lifelong immunosuppressant medication needed to prevent rejection. Improves quality of life and lifespan, but carries risk and requires lifelong Medicare. So, what is the role of a cardiac transplant? It treats end-stage heart failure or certain congenital heart defects. It improves cardiac function and quality of life, extends lifespan for eligible patients, provides a chance for a new lease on life, offers hope when other treatments have been used already and it didn't work. So, patterns of when someone would need a cardiac transplant is end-stage heart failure for not responsive to medical therapy, severe coronary heart disease, inoperable congenital heart defects, cardiomyopathies, severe heart valve diseases, and refractory arrhythmias, complications from previous heart surgeries or treatments, required quality of life, and poor prognosis despite medical management. And then as you can see in the background, this is an ECG. So this is a heart monitoring system, and you can see all the valves and what is going on in the heart to see if their heart is looking good or if it isn't. So genetics for heart disease. Genetic mutation leading to severe cardiomyopathies is dilated cardiomyopathy or hypertrophic cardiomyopathy. It is inherited arrhythmia syndromes, so long QT syndrome, and so on. Rare genetic disorders affected heart development and function. Family history of early onset heart failure or sudden cardiac death. Progressive deterioration of cardiac function despite optimal medical management. Genetic testing may identify specific mutations, indicating a high risk of severe heart disease. So, progression of cardiac transplant. It evaluates for eligibility, placement on the waiting list, surgery, removal of old heart to donor heart, ICU stay post surgery, lifelong immunosuppressant medication, regular follow-up and monitoring, rehabilitation and lifestyle changes, long-term management and support. Symptoms of having a cardiac transplant. It improves cardiac function and exercise tolerance, resolution of symptoms like fatigue, shortness of breath, chest pain. Potential side effects for immunosuppressant medication is it could increase risk of infection or kidney problems. Regular monitoring for signs of rejection, which could be fatigue, shortness of breath, swelling. Potential complications such as infection or organ rejection or medical side effects, and also adjustments and emotional impact of the transplant process. Okay, so diagnosis if someone needs a cardiac transplant. So it would be end-stage heart failure symptoms despite optimal medical therapy, objective evidence of severe cardiac dysfunction, inoperable coronary artery disease or structural heart defects, evaluation of other treatment options or their limitations, assessments of overall health and suitability for transplant for surgery, and evaluation to assess the readiness for the transplant process, like a psychological evaluation. Placement on a transplant waiting list based on severity and urgency of the condition. And usually, cardiac transplants don't happen right away if it's a life and death situation. So some people who had the disease and like they're waiting a long time to get a cardiac transplant because there are very long lists and people who really need it, they move up top of the line, and then who doesn't really need it that much, they keep going down the line of the people who actually need it like right away. So the effects of cardiac transplant on the exercise response, it improves exercise tolerance, enhances cardiovascular capacity, quicker recovery during exercises, potential effects from immunosuppressant medication, and individual variability in response. So management and meds. Immunosuppressant medication to prevent rejection are a lot of medications. So I gave some right up here, up top, that you can see. Anti-rejection drugs require lifelong adherence and careful monitoring of blood levels. Antiviral and antibiotic medications to prevent infections due to suppressed immune system. Blood thinners to prevent the blood clots. Medication to control the blood pressure. Diuretics to manage fluid retention. Cholesterol lowering medications to reduce the risk of cardiovascular complications. Regular monitoring of medication levels, kidney function, and overall health status. Adjustments of medication regimen based on individual responses and potential side effects. Comprehensive management plan, including lifestyle modifications, regular follow-up appointments, and psychological support. So my research. High intensity exercise can affect the progression of a heart transplant recipient condition. While exercise is generally beneficial, transplant recipients require carefully monitoring due to the potential stress on the transplanted heart. It's essential for them to follow up a supervised and tailored exercise program to minimize the risk and optimize their health. So as you can see in this picture, you can see the incisions of on the aorta and the pulmonary arteries. And so since they got the procedure done, it is very hard for them to do a lot of different things. So they have to focus on like taking care of themselves, not really doing too much because it will put a lot of stress on the heart, and they have to wait like 4 to 8 weeks to be able to do a lot of things, like going to the gym, for instance. So also, the research that I was looking at, what is the main causes of getting a cardiac transplant? So I was looking into 2010 to year 2022. So this is a chart of distribution of adults waiting for a heart transplant by diagnosis. And what I thought was interesting, cardiomyopathy is up there of the percentage of the people waiting for a cardiac uh, transplant. And so that's one of the main diseases of having a cause of getting the cardiac transplant. And also the coronary artery disease is up there. So the case study that you would look into for a cardiac transplant patient is the patient's medical history and overall health status, the risk group clearance, determination of need for medical clearance before starting exercise program, exercise testing, baseline assessments of exercise capacity, special conditions monitoring for exercise related complications and individualized adjustments as needed, risk stratification assessment of potential exercise related risks based on the medical history and the current health status. And also their goals and exercise prescription would follow frequency, intensity, time, and type. So for my exercise prescription, we would typically fall under 3 to 5 days per week. And we would obviously start at like a low moderate intensity to target 50 to 80% of the maximum heart rate. And then also, or you can do 11 to 14 of the Borg rating of perceived exertion scale. And then the time initially would be 20 to 30 minutes per session, gradually increasing 30 to 60 minutes as tolerated. The type we would work on aerobic exercising, such as walking, cycling, swimming, etc. And also the resistance training, we would do light to moderate resistance exercising, targeting major muscle groups 2 to 3 times per week. Flexibility is also very important to prevent will also like reduce the risk of injury. And we would do an individualized program, tailored exercise prescription based on that patient, their capacity goals, and their cardiac transplant status. And we would also do a regular monitor the exercise response and adjustment prescription as needed based on the patient's tolerance and progress. For the exercise tests, we would do the graded exercise tests, cardiopulmonary exercise tests, stress echocardiography, electrocardiogram monitoring, and the functional capacity assessment, individualized exercise protocols. So for my conclusion, I want you guys to get out of this is that transplant provides a vital opportunity for individuals with end-stage heart failure to regain the quality of life and extend lifespan. Through personalized care and ongoing support, recipients can achieve significant improvements in health and well-being. And one of the main issues of the reasons for heart transplants is cardiomyopathy disease. That's one of the main ones of having a heart transplant. And then these are my references. All right. All right, well, have a great day.